Everybody, today we are talking plastic surgery with world-renowned plastic surgeon Dr. Marc Mani. I'm going to talk about my neck lift, my TCF lift. I'm going to let you guys start coming on, but we have got a big show today, and I just expect that we're going to get a lot of hate coming on. So I'll let you guys start coming on, and I'm going to invite Dr. Marc Mani on in about, I want to say about 5 or 10 minutes. Okay, I want to make sure that everybody starts coming on first, but Dr. Marc Mani is going to be on the show today, and we're going to talk all things plastic surgery. So for those of you who missed this when I just put this out, this is my before and after of my neck lift, which was 7 years ago. I'm going to go over all of this, and we're going to talk about various things in terms of like the risks of plastic surgery, how to find a good plastic surgeon, the realistic expectations, because I've often said there's no amount of surgery that's going to give you great skin. That does not come from plastic surgery, you guys. That comes from health. That comes from skincare, which is what I do at home. I am not a plastic surgeon. I'm not even an esthetician. I am a healthy aging expert. I am a gerontologist, which is somebody who studies the aging process, okay? So that's what I do. I'm also a certified holistic nutrition and health coach. I'm also a certified 500-hour yoga instructor. There's a lot of education that goes into here, but one thing I am not is a plastic surgeon, nor am I an esthetician. But I do look at skin as an organ, and we talk about the health of the skin through microneedling, through red light therapy, through radio frequency, through microcurrents, through a lot of different stuff that we do at home. Hi, Nurse Karen. Dr. Mani is going to be on in about 5 minutes. So I wanted to, before we get into it, for a lot of you guys have seen that I have been slammed on social media recently. So if you're here to see Dr. Mani, we're going to talk about all that. Give me like 3 minutes. I've been slammed on social media from people that thought they were calling me out. This one guy in particular thought he was calling me out, that I have hid the fact that I've had a neck lift and a lower face lift 7 years ago. And I will go over that with you, but there is a full YouTube video. All you have to do is Google Darnell Cox facelift and it comes up, okay? You can't get more open about it than that. I paid to have my videographer in the room with me. I paid to have this video edited. I put it up on my channel. Okay, so there's no hiding anything, but we're gonna get to all of that stuff. But before we do, expect some hate, okay? Because I still have all of these followers from this one guy who called me out on something, who thought he caught me in something. I think those people are just unhappy, and hurt people. I 100% agree. And I tried to reach out to some of them that I thought, oh, this person is worth reaching out to. They're not coming at me with like, you effing C word, blah, blah, blah. They're not like that, but they were like, you shouldn't have hid this. And I would have a conversation with them about it. And a lot of people who then, thanks KT Drew, I love you too. And for all of you guys who came to my rescue, who stood up to this guy and said, she's been open and honest about a lot of different stuff. Everything that she does, she has filmed, and I've been following her for years. In fact, some people found me from this video that I did and then started following me, okay? My age is 56. I'm 56 years old. I've had a neck lift. I've had a lower facelift. I've had my breasts done. Shocker, okay? But honestly, it's none of their business. That's exactly right. But when we start getting hate on here, which we might get, I just ignore them, because I've been trying really hard to ignore them. I have had these conversations with some of his followers who have apologized and said, I'm sorry, he got this one wrong. I've been following you for years. He got this one wrong. Yet when I confronted him, and I don't even want to say his name, but when I confronted him, and when I made the post on the post that he did, when I put it in the comment section, he hid my comment. I sent him my whole graphic 18-minute, when it's edited, video of me. Look, this is me, you guys, in surgery. This is me in surgery. I paid to have this videoed, edited, and posted. It cost me a lot of money to do this. That has nothing to do with skincare. The health and the quality of your skin. Completely different. If you think that you're going to get a facelift and you're going to have, great skin, it does not work that way. Hi, Christine. Okay, let me see if I can get him on here. We're going to talk about this. You guys, if we start getting hate, please ignore. Don't add fuel to the fire. There are some of the followers that, like I said, have apologized. And for those of you who have come to my rescue, I really appreciate it. Let me just say this one part. I really appreciate you. I see you. I'm so thrilled that you have come to my support, but I want you to know I'm fine, okay? Like I said in my reels that I just posted, I'm a 56-year-old menopausal woman who's got 3 kids, 4 if you count my stepson, which I always count. But it's, I've got thick skin. Through microneedling, because that thickens your skin, through retinoids, because that thickens your skin, but metaphorically, obviously, because of life. And there's not a man on the planet that's going to be able to tell me what I should do with my face or my body. No, not happening. Okay, now let me see if I can get Dr. Marc. Be moving around a lot. You guys will find out where he is. He's at a conference right now. Here we go. Hi, Dr. Mani.
Hi, Darnell. Hi, everybody.
And I'm so thrilled that you're on the show because we've got a lot to talk about. But first, tell me where you're coming from right now, because I know you're outside. You may have to move around a little bit, but tell me what you're doing right now.
Yes, I'm. Well, thank you for having me on, first of all, Darnell. And I kind of followed this little mini scandal when it was happening because I got some comments on mine. I was like, who the hell is stalking Darnell? That's not right. That's not fair. And so I'm glad you invited me. Right now, I'm presenting at the UCSD Center for the Future of Surgery. There's a meeting here called San Diego. It's a regenerative conference. And it is all about regenerative medicine in general for musculoskeletal disorders and things like that. But I was invited here to be on a panel with Dr. Tim Martin, who's one of the leading facelift surgeons that a lot of people have heard of because of my Scarless Lift, which is an endoscopic, hi Christine from Germany, endoscopic approach to do a full deep plane or composite lift facelift without a scar in front of the ear. So that's what I've been invited, and I'm also feverishly preparing 11 lectures. I'm going to Melbourne this coming week, Australia, to co-teach an anatomy course with Brian Mendelsohn, who's probably the foremost facial surgical facelift anatomist in the history of facelift anatomy. And so anyway, that's what I'm doing.
Okay. So for those of you who don't know Dr. Mani, because we're going to, you've traveled the world and you lecture on this stuff, that's how good you are. But I'm just going to give you a little intro. So Dr. Mani has practiced plastic surgery and reconstructive surgery in Beverly Hills, California for the last 23 years. He's a graduate of Harvard University and Baylor College of Medicine, integrated plastic surgery program. Dr. Mani is also a practicing artist. If you've ever gone to his office, you do sculpture, you do painting, you're really a very visual, artistic person. And I think that that's important when we're talking about the nuances of the face, to have somebody that really has a creative eye and can see that. You're one of the main modern innovators of the deep plane facelift surgery. And you developed the Scarless Lift, an endoscopic, minimally invasive deep plane lift with no visible scars. And you devote a significant amount of time of your surgical practice to reconstructing the injuries of victims of domestic violence, terrorism, and human trafficking as chief surgeon for the charity Face Forward International. Welcome to the show.
Thank you.
Dr. Mani. Okay,
thanks for having me.
Tell me a little bit about, before we get into the new technology of the facelift that you're doing, this deep plane scarless facelift, let's talk about the stigma of plastic surgery, because it's really profound. So give me your experience with that.
I'm very philosophical about what I do. I think one of the reasons I do the charity work is that, I have to balance the aesthetic surgery with that. And aesthetic surgery is very gratifying, and but it's nice to employ the reconstructive skills that I have. And I've done some of the regenerative procedures, the MIST procedure, which is adipose-derived or fat-derived stem cells for the charity patients and aesthetic patients. So just like to stay on the forefront of that. But one of the things I do lecture about is the stigma of plastic surgery, and being a facelift surgeon primarily, I do body surgery and noses also, but mostly on facelift patients and their relatives and referrals from them. But one of the things that I lecture about is avoiding the stigma of plastic surgery, avoiding the stigma of a facelift in particular, because you can say the word face and you can say the word lift, but if you say the two words together, it's like you did something awful and you have a stigma for the rest of your life, which is exactly what's going on with this person that's coming after you. And I think he provides a service. I've looked at some of his other videos. I've always been someone that likes to debunk urban myths, but you're not in that category because you've always been honest. But the way I look at the stigma of plastic surgery is that we're animals, and so we have an inherent evolved need to deceive. Basically, when you have a rhinoplasty at a young age, your goal is to be more successful at mating, to deceive people into thinking you have better looks. And I take that to heart, and I have a video of a mimic octopus that morphs into a sea sponge to hide from predators. So, so basically my point is that if someone has obvious surgery or filler, which is I think much more common, that's obvious, they don't look better or younger, they look like a liar. And I don't want that. I want everything to be stealthy. And so I understand in a way the stigma of a facelift, but I also think it should be destigmatized.
For sure, especially since we're living a lot longer, right?
Yes, that's the
And
goal.
that's the goal. And menopausal women, we're now, menopause is having its moment. In fact, you guys join me next week because I'm going to be talking about hormone replacement therapy and menopause, and I have a guest coming on, but we'll talk about that later. But during the pandemic, people were looking at themselves a lot more on Zoom, right? So I'm sure like people that were kind of scrutinizing their face as they have never done before because we're doing a lot more work through Zoom. I noticed that I got a lot more clients that were interested in like, okay, what do you suggest? And a lot of them I sent your way. There's only so much that at home things can do, right? We want to make sure that we're treating those things and we're using adequate skincare and we're protecting our skin from the sun. And for me, when I'm talking about the health of the skin, I want to do microneedling at home. I want to do I want to do these kind of things at home and make sure that I'm having effective skincare. But that takes you so long. And then you have that decision to make. Do you go under the knife or not? And that is a personal decision based on many, many different factors. Because I'm in the health and wellness field, I've always felt, and I talk a lot about the health of the skin, and I have an inside out, outside in approach to aging. So we talk about how do you sleep? What is your stress? What are you eating? How are you exercising? But we also address skin as a large organ. So that said, what are the realistic expectations of some of the surgeries that you're doing? And I'll give you guys my before and afters, and we can talk a little bit about that. But what are some of the like how many years does a Scarless Lift take off of people?
Well, I think it varies, but like you asked me earlier, the average age for my facelift population is 50, and that's particularly since I started doing the Scarless Lift. It's good for something, I call it a filler killer, because it can get some of these, especially, entering middle-aged women, even late 30s, if they've lost a lot of weight, if they've had a lot of filler, it blows up your face and then it shrinks. That can take the clock back. If someone's 50, it can take the clock back to mid to late 30s. The goal of having a facelift is not for people to say, "Oh my God, she looks so young." And that's part of it. But most of my patients say, I want people to say, "You never age." Wow, you never age, at their high school reunion or a wedding or whatnot. And the other thing that's relevant to what you were just talking about is the fact that, a facelift, this is one of my frustrations doing facelifts, is a facelift addresses the muscle undercarriage of the skin very beautifully, especially a deep plane facelift. but you still have to maintain your skin. And that's why I developed the MIST procedure, which we did on you. And it's a regenerative procedure. I think lasers and microneedling and all those things work because they influence the cycle of re-injury and healing that can refresh your skin. They should be used in moderation. But I do this adipose-derived stem cells and fat transfer to replace filler if someone needs volume. And then not only can take the clock back 10 to 15 years, but it should last 10 to 15 years, particularly the Scarless one, because it's typically done at a relatively younger age where the tissues are stronger and they hold up longer. So one of my colleagues once said that, if you have a facelift at 50, it's going to last 15 years in the right hands and with the right genetics and type of and skin maintenance. If you have it done at 60, it'll probably last, 8 to 10 years at the most. But, at the same time, yeah, I think I think it makes sense. It all, if you're 60-year-old person, you're not going to be able to lift as much weight because your protoplasm has been weakened by the ravages of ages and, telomere length changes.
Yeah.
It's not, the same goes for healing. The same goes for, when I put a stitch through a SMAS layer in a facelift of someone that's 45, it holds more, it's thicker. And a lot of that depends on genetics, but that's the answer. We're trying to take the clock back, but in a way that's natural. All these procedures, all these techniques that you're doing, facelift surgery in particular, it's not for everyone. And so the people that are hating on it, they're never going to have one. Fine, there's no judgment there, but neither should they judge you or anyone else, in particular someone that's been completely candid and authentic about this. I mean, I think all the person that went off on you and all the followers that went off on you, while again they're providing a service, and I kind of think it's funny in some cases, and I think they get it right in a lot of cases. They failed to do due diligence and notice the fact that your surgery was on freaking YouTube. It's out there. And not only that, it's on my page. It was right there. And I suspect that they noticed it and didn't mention that part. So it kind of goes both ways. If you're going to debunk someone and go after someone, tell both sides of the story. In your cases, I can see why they did this. Why isn't she talking about her facelift? But at the same time, it was 7 years ago, and that's not really what you're talking about with the way you maintain
Right.
yourself. I know you, I love you, your personality, your soul, it's beautiful,
Oh.
and so it hurt, kind of painful for me to see that happen. And when I was like, what the hell? Why, of all the people to go after, it's totally ridiculous.
Yeah, it was, when I reached out to some of the followers that I literally sent them the video, right? So I went in, and when they would say certain things, I sent them this link that shows exactly what it is to have a full, a TCF list with the neck lift. It's a lot. Well, let me get to the surgery part, but I mean, this is stuff that I posted. This is immediately following the surgery. I talk
Yeah.
about all of this. I talk about the post-care,
Hmm.
how it's very, to be honest with you, the most difficult surgery that I could have imagined,
Yeah.
because you get your eye on the result, right? And
Yeah.
I have a goal, you guys.
I call it getting hit by the beauty
Yeah.
bus. There's beauty at the end of the tunnel. If you have a friend that does it, you're like, and if there's not some swelling into here and some bruising right here, especially where the facial vein is and some other veins there, your result isn't going to be as natural and it's not going to last as long. So all that swelling, it varies, and I always come up with new ways, which I've done since your surgery, of combating that, preventing it. We have an acoustic wave machine. It cost me 60 grand, but it's worth it. We just do it as part of the package. Hyperbaric oxygen is big. So we found ways to manage it, but that's just part of it. That's part of the recovery process. So it was very
That's
nice for you
part
to be
of it. And
candid.
so you really have to have, there's a lot of things that that you should do before, if you're thinking about doing it. And maybe this is where we want to go next, is how do you find a good plastic surgeon and all of that. But the realistic goals, I think, is super important, because there's no amount of plastic surgery that's going to give you great skin.
Hmm.
There's no amount of plastic surgery that's going to give you a better job or make you happy, or, so you have to go in with realistic goals. If you're an unhappy person and you're thinking that the plastic surgery is going to make you happy, you got to start at the root cause of that first. And it's
Yeah.
not, it's not going over
Yeah,
the.
Jordan Peterson, who's a famous Canadian psychologist that I admire for his intellect and just the rigor of his intellect. His daughter has a podcast, Michaela, And I told her, and they don't like psychiatry, which I can get, but I said plastic surgeons are kind of like a psychiatrist with a scalpel, and I said, which is kind of scary. And she, without missing a beat, she said, as if psychiatrists could be any more scary. But I have started to embrace that part of the journey where you see the patient's overall arc and their path, and especially with women, it's it's just a fair enough statement to say it's an emotional journey going through a facelift, and I embrace that and take them through it. But yeah, you were about to show a picture of your beautiful wedding and your amazing
I
husband, who
think
is also I love.
you were at
Uh,
my, Dr.
I
Marc
was
Mani
there.
was at my wedding.
So you
So
weren't hiding it. Yeah,
I wasn't,
you didn't say
Dr. Marc
you
Mani
said
was at
hi to
my,
me and you talked to me. Thank you. Sometimes that doesn't happen if I see a patient in public. I obviously demur and don't go,
oh, no, no,
no.
no. Whenever I've seen you in public, I throw my arms around you. But I feel like, when people are deciding, is this something that I want to do? To have a goal in mind that you think is realistic, to get multiple opinions. This was my goal. I had my surgery 3 months before this.
Mm-hmm.
I was about to get married. I was 49 years old. It was my second wedding. I did not like, I'm going to show you my before. I
Yeah,
did not
the
like
pour is
this
on the
part.
right.
It
Yeah,
showed in every video, and I was already on YouTube here, but this showed in every video.
right.
And so what you did with this was give me the goal, and I said, I want to wear a white dress.
Yeah.
I want to have a photographer there. I don't want to go back and think like, well, shoot, I'm going to have a facelift the following year. Might as well do it right before. And
Yeah.
this
So
is
that
the
was 7 years
result.
ago. Let's see your jawline now, Darnell. I haven't seen you in a little while. So that looks pretty damn good. That's 7 years out. And yeah, well done, deep plane fin. Your cheek highlights are really nice. And I know that you've had some, you haven't had hyaluronic acid filler. You've maintained with some of the regenerative things,
Yeah.
PRF and PRP. That's
Yeah.
the best thing to do. That's what I tell
So how
patients.
I've maintained is literally a microneedle. So I'm creating those microtraumas to have, stimulate collagen production. I've done Sculptra, which is not a filler. It's not a hyaluronic acid filler, but more of a collagen generator. I've done a PRP filler where they solidify the PRP, which is using your own blood. But I don't have any of the standard hyaluronic acid fillers in. And let's talk a little bit about that, because in my before picture, which you see here, this is how I met Dr. Mani. When I met Dr. Mani at 49, this is what my face looked like. You can see I'm a little heavier here than the after, but it's
Mhm.
subtle because of my age, because I was
Yeah.
49 at that time. And that is what's going to get you a subtle result. But you can see I'm a little heavier down here. And then this brought the anatomy back up to the cheeks.
Yeah.
That's
And the other
good
thing is,
work.
as I thank you. Yeah, no, it's subtle and stealthy, and that's the goal. And I think being an artist, that's what's helped me a lot. I originally went to medical school wanting to do cardiac surgery. I went to Harvard undergrad and went to Baylor for med school specifically for that reason. But I think that I knew I had the dexterity to do fine motor skills surgery, and just being an artist, that's why I went into this. And I think that one of the things that I was going to think about is that with your surgery, at 49, if I were doing it today, and I was still on the fence at that point because I was just starting to do a lot of the Scarless procedure. I think we talked about it. I
Yeah.
thought about doing you Scarless. Nowadays, I definitely would have done you Scarless because you didn't really have a lot of excess skin, and we're just lifting the muscle. But that's the whole point of, lifting the deeper layer, and then you do the facelift. We don't have your pictures after I dissolved your filler.
Right.
We were talking earlier about how it's not fair to you to show that picture because that's not how your people knew you. And
Yeah.
but I put them up, and there's a little bruising, so it kind of confutes the issue because you see the bruising and everything sagging. But at the same time, I'm very adamant, and I'm lecturing here and in Australia and Cairo coming up about the need to dissolve hyaluronic acid filler. You know, I can tell you where a lot of people, even dermatologists, are talking about how the HA fillers are going to be gone in a few years. I can almost promise you that, because they cause so many freaking problems. And it's not that I have technical issues getting through them during a facelift. I don't, because I dissolve them all first, because they'll screw up lymphatic drainage. But people, I have a joke that I tell, which is a half joke, that in 800 years, archaeologists in Southern California, they're not going to find any buildings or roads or skeletons or whatever, mummies. They're going to find the hyaluronic acid filler. I won't name any brand names, but I think we all know what they are. And they have their role, you know, they definitely have their role, but they're going to be supplanted by things that are better. We as surgeons, we're smaller in numbers, but we have a duty, and I'm very vocal about this, to educate people about how these things, hyaluronic acid fillers, are not good for your skin. They cause chronic inflammation in your skin. I can show you dozens, hundreds of pictures of that, where the skin gets better as soon as we dissolve the HA filler.
Yeah, it's interesting. And I what I found with that, because in this picture, you guys, so this was at 49. I had done all the regular maintenance, that, not the regular maintenance, because I don't feel like the way that I address it is necessarily regular, but it was for me. This is Botox, this is filler, this is microneedling, this is at home stuff, this is skincare. But when we did, before you do any sort of surgery, all of this gets dissolved, because you need this, you need the extra slack. I often think of filler as like, it's like blowing up a balloon too many times, right? You blow
Yes,
it
yeah,
up.
and then it deflates, and that's why, like, I don't operate on people that are overweight. I don't operate on people that can't control their weight. You know, I do a little bit of fat transfer sometimes, and if you gain a lot of weight after or go through menopause after, that can blow up. So you have to make patients understand what's realistic, and this is not just something to put a Band-Aid on you cosmetically. You want to maintain a healthy lifestyle before you have a facelift. I think that's really important, like you do.
Yeah, so I'm looking at some of these questions in the chat. People are wanting to know, do you recommend, what would you recommend if you don't recommend filler? What would you recommend for fuller lips? So that was one of the questions.
Yeah. I do fat to the lips. I like fat to the lips. You know, a lot of surgeons, you know, don't do it, and the knock on it is it doesn't last as long. But if you do it right, and you do it very, you know, gently with the right amount of passes with the cannula, it works beautifully. You know, I like lips to be natural. I tell patients, if they're going to go out and have a lip filler, a lot of lip filler after I operate on them, I will never talk to them again, which is not true really. But I don't want to work on them, because it's my brand, and the brand
Yeah.
is natural.
And it
Yeah.
looks unnatural. When I had my my neck lift, I went in for a neck lift, but you can't really get this result without doing the lower face. You just,
That's right.
you
Yeah,
can't.
because the muscle, the platysma and SMAS layer are contiguous. I tell people it's like a hammock that goes from one cheekbone to the midline and connects here. It disconnects over time, but we're resuspending all that. And in order to get it done right, you have to go in a vertical direction. And that's
Yeah.
the thing I've also really embraced from doing the Scarless technique, because it gives me a more natural vertical vector from up here. And it's beautifying and rejuvenating at the same time. You're right though, you can't really get this up here. Now, there is, in certain younger patients, there's a deep neck lift where we only make an incision here. I've done this. I've done this on some entertainers that didn't want anything even back here.
Mm-hmm.
But in general, you're better off also lifting from back here, and that can be done endoscopically also. That's the way I do that.
Yeah,
And some.
agreed. So I went in wanting this gone, but the best way to do this is to do a lower. So if you're somebody who's only you're thinking, I don't ever want to do a facelift, but I want my neck done, it's, you're not going to get as great a result than if you move the whole anatomy up at the
Yeah.
same time.
Yeah. Yeah. And then that goes back to the idea of, I think, the stigma of people not wanting to have a facelift. And all you got to do is call it something different. And so, you know, the Scarless Lift is a facelift. But there's just, and I know I'm getting older, you know, and I'm thinking, who would I have do my facelift? The honest answer is really no one right now. I'm training a lot of surgeons overseas, Brazil, Turkey, I'm going to teach them there a little bit. And and in Europe, but it's something that you think about, and that's the thing. It's the scar, particularly in men. It's not so
Yeah.
much. I mean, I can make it invisible. I have like Tim Martin, who I just talked to, has beautiful scars. Brian Novak are the two notable ones where it's invisible, like I like. But just the fact that I have it there, that I would have it there, it's a stigma. And I've been honest with my patients, not on social media, about things that I've had done. I had my nose tweaked a little by my friend Richard Zumalin, who's a brilliant artist. I've had 3,000 hair grafts. I have a lot of my own hair, and I'm going to, I'm doing 2 live surgeries in Cairo, and then I'm going to go to Amsterdam right after that and have the third of all the surgeons that have done hair work on me just to fill this in a little bit. My goal is not to have the Ronald Reagan hairline, but just to have, a little bit here. So,
It
you have
looks
to,
great.
you have to back, you have to walk the walk. Thank you. Yeah, everybody says that. I just think it a little bit more, but
Yeah,
then
I
you
think
move
it
on.
looks great. They're improving hair restoration and hair transplants. I mean, they're not the same
Dramatically,
Barbie
dramatically.
doll
That's why I
look.
think about that too. Yeah, it's an art form, getting the small grafts to survive, and also, one of the things that all respected Turkish surgeons for doing this so well, technically. But I think one of the things I see a lot out of Turkey is these guys come in their 20s and 30s and they want a hairline like that. Well, number one, when you fill in all the way across here, it actually makes your forehead look even bigger because
Yeah.
a masculine hairline has a frontal forelock and a little temporal recession. Not as much as I have, maybe, but I don't want to be too aggressive about that. But
I
you're
know.
right; it's definitely better and better
Yeah, it's
for the hair.
getting better and better, but you can tell when somebody goes to a wrong place when it's like straight across.
Yeah,
It
and
looks like
that's,
a
and
hump.
again, it's like, these men, some of them, trying to be successful, get their confidence back for the dating pool and things like that. You know, I say this all the time in lectures. The human brain evolved an area called the fusiform facial area in the temporal lobes, which is responsible for recognizing the expression, authenticity, and the youthfulness or aging in a human face in a way that evolved before spoken language. It's no question once we started standing upright. So it's a very primitive and complex ability that we have to detect that. So if a woman or someone, a man, is looking at another person of the opposite or same sex for attraction reasons, and they have, a hairline like that looks pluggy or just too dense, they look like a liar. They look dishonest. And,
Yeah.
Joe Biden is an example I give of someone that had, they talked about his dementia. I think his plastic surgeon had dementia because it's one of the more awful facelifts you can see. And it's not a political statement to say that, because I think the other side, Donald Trump, has eschewed any cosmetic procedures, which is fair enough. And so I'm not making a political statement, but it's an aesthetic statement to see the scars and things like
Yeah.
that honestly certainly didn't help him in his effort to be reelected.
Okay, we have a couple questions. One is, how do you resolve fat transfer to the lips that has migrated? Have you dealt with fat transfer to the lips that has migrated before?
No, I think if it's done right, it stays in the same place. You sort of do it into the muscle and just do it, in little tubercles that kind of intermesh with each other, like that. And I haven't had it migrate. I've certainly had. Maybe they're thinking about filler.
Yeah.
I have dealt with a lot of filler that's migrated. And my friend Dan Gould, they did a study of lip lift specimens where they took out the little seagull-shaped skin of lip lifts, and 29 out of 30 had a filler in them that had migrated up from the lip. And so we definitely see that a lot. But fat, I'm sure fat can migrate. The way to deal with it, and I have done this on occasion, is that you just do microliposuction and you can suction it out. I've never had to do that on one of my patients. I have had to do that on patients that were unhappy with it from elsewhere. So almost anything can be corrected except for an overdone facelift. If there's too much skin is removed, then you really have a problem.
Okay, another question is, what is your thought on threads, the PDO threads? I already
Yeah,
know this.
PDO threads, not so much. I mean, it's not just because I have a somewhat biased view being a surgeon. They generally don't last for any more than 6 months. And so, and you spend some time in recovery and pain going through it. So we see a lot of unhappy patients with that. My goal is to have a 99%, 100% success rate. That's unrealistic, but it's close with facelift surgery. Threads generally don't work. And so I would definitely caution people against that.
Doesn't it also create like a bit of a weird mesh under the skin that's hard to then get in when you're doing a deep plane lift? Or what is your thought on
Yeah,
that?
I think, we have text threads between, thousands of surgeons around the world where we talk about how we deal with these complications. Threads are not that big of a deal, but they can be. And I've seen threads intertwined with facial nerves where it's pretty dicey to get them out without traumatizing the nerves. So yeah, that's another reason not to do them. And then the other thing that's very difficult a lot of times, if biostimulator filler, which is polylactic acid, as known as Sculptra, or Radiesse, which is hydroxylapatite, those things, if they're in the mid-face, that can be dicey. I had a patient recently I was doing endoscopically that had like a golf ball of a Radiesse right here on either side. And I got through it endoscopically, but it was technically difficult. So I try to tell injectors, just don't put those things in here. And even hyaluronic acid filler, when they start putting it in here, you get a deeper nasolabial fold and you look worse. It's just a,
You know what's
a
interesting
failure.
that you say that, because, and I think that this is just attests to your knowledge of the anatomy of the skin. But when I have gone in and done like the Sculptra injections, which is the collagen stimulator, or I've done recently, I just filmed the PRP injections with Ellie Lambert, where she solidified PRP, which is your own blood, the platelet rich plasma from your own blood. It's here in the temples that I get it done, right? Because this is where I feel like we lose fat in the temples. We get a hollowing in the
Yeah.
temples and a hollowing of the cheeks. Does
Yeah.
this affect having whether it's fat or whether it's doing Sculptra or whether it's doing more of the PRP natural fillers? Does the fillers in the temple affect the deep plane lift that you're doing?
No, not so much. Fillers in the temple, I have, I don't know if I've talked about this. I have an ultrasound that I call the filler killer that I use where I can actually see where the filler is and watch the needle go in. And there's a radiologist in Australia that started doing it that way. And so that's how I'm going to do it. So I can see it here and dissolve it if it's hyaluronic acid filler. If it's regenerative things like the PRP, that won't bother me at all because that just integrates and adds a little fullness. But if it's Sculptra or Radiesse, mostly Sculptra is put here, I can get through it. It does create like, it's kind of like chewing gum getting through it, but it's not a deal breaker, and it's not a deal breaker out here. I'm not in love with it. I don't, I actually like Sculptra aesthetically in the right hands. There's certain people that do it beautifully. It doesn't block lymphatics as much, and it does create kind of natural contours. But fat is the answer if you want volume. If you can do it, it's more costly. And there's a little bit of recovery involved because you have to have micro liposuction, but that's not a big deal. It's definitely the best way to go.
So if you're going in for any sort of plastic surgery that involve, whether it's a tummy tuck, which there could be fat removal in a tummy tuck, you want to save that fat, right?
Yes. Yeah, yeah. Well, then that's one of the problems I have. I have a slide here that I show in LA. We have so many people that are super fit and that even women try to get down to minimal body fat. I personally think that's not really healthy to get that lean because fat produces estrogen, so you need a little bit of body fat. But, most importantly for me in my practice, doing all this regenerative work and fat for volume, I need people to put on a little coat of fat on their abdomen or flanks. Most people have it, but if you don't have it, that's kind of an issue. We freeze it sometimes, but what I do and we really do get this as a serious answer in LA when I tell people you need to gain some weight. The answer is, how do I do that? And that's not something that people in most of the world would have a problem with understanding.
Right.
But in LA, it's like, whoa, wait a minute, I can't eat kale all day. And so so what I do is I send them a screenshot of all the Kentucky Fried Chickens in the area. And I was in Florence, Italy with my daughter preparing that lecture at one time. And I looked for KFCs in Italy and there were ones there. And they said, the
Wow.
one
Just
thing they
do the
said,
opposite of everything I coach and you'll put weight on.
yeah, you'll put weight, but you can do it healthily. You can do it with olive oil, avocados. Healthy fats are
Yeah.
fine too. That fat is usable also, and it's not.
Okay, so we had a question come up about what do I do if I have had silicone put in my lips? I already know the answer. This has to do with like going to get your work done and trying to get a bargain on
Yeah,
good work. It's not gonna.
yeah. Yeah, it's a tough problem. I've had a few patients. I don't really do this anymore because it's too much work, but you can have it surgically removed, but the problem is the silicone creates granulomas that come back. And so it's an endless process, and the patients are upset because they probably were trying to save money in the first place, and then they're having to pay through, decades to have it removed every time. There's some notable celebrities that made that mistake, and yeah, that's just the answer is don't do it. There are probably people that can remove it, but it's a chronic problem. It's definitely not something wise
And
to do.
also, isn't it like when you try to do surgery on silicone, free floating silicone that's been injected in places, do you not run the risk of activating that and causing more of those granulomas to
Yeah,
produce?
it's a risk. I mean, if I'm going to do someone that has silicone in this area and I'm doing a facelift, the problem is I have to do a two-layer procedure, which I wrote one of the seminal articles back in 2016 about why a deep plane or composite lift is better. It's very simple. It has to do. There's a sandwich video on my website, on my Instagram about this. Keeping both layers attached, you get more volumizing effects without having to rely on fat transfer here. But when I have someone with a bunch of that stuff, whether it's silicone or there's something like PMMA or things that they have in Europe and the Middle East a lot, I have to separate the two layers, which gives you kind of a weaker tissue repair,
Yeah.
because I have to try to get to all that filler. It's not something that I do very often. I think probably surgeons overseas do that more often because they see that kind of malfeasance more.
Okay, we have a question. Do you do breast lifts with implant removal? I know the answer. Yes, you do all of that stuff.
Yeah, I do that. I mean,
You
yeah,
specialize in the face, but you do everything. You're an artist. So
yeah,
I've sent people for breast lifts. I've sent people for tummy tucks. Like
yeah.
you do
Thanks.
everything.
I do everything, but like I was saying, I'm a facelift specialist. That's the surgery that I think is my wheelhouse and my happy place. It's something that that's why I'm lecturing a lot, is because the other surgeons see the results. For facelift surgery, particularly the Scarless one, I get as many referrals from other plastic surgeons as other doctors, dermatologists, and the people that see it at conferences. Yeah, I think that a referral-based practice is better, and then doing it that way is definitely the best way to do it.
So
Do it
we've
with
got
a deeper layer.
this question. With your mist procedure, would it extend the need of a facelift?
Yeah, that's really the answer is no. The MIST procedure, and it's funny, I'm here in San Diego with the two sort of innovators that started doing what's called nanofat, or MIST is my special version of nanofat. And MIST doesn't tighten the skin. We do Potenza, which is the latest form of radiofrequency microneedling, to prime the skin with little micro injuries because stem cells respond to injuries. But it doesn't tighten to the degree that a facelift does. So a lot of my patients want to get their feet wet. They want to, they get to know me and vice versa, and they have the MIST procedure because it's local, it's in the office, but it's not going to particularly, fat transfer can, but I'm not one that's going to say wait on a facelift if you have some laxity here and some masculinization and squaring of your face if you're female, because I can do it without a scar here. Before I started doing it endoscopically, I would say that. Yeah,
Yeah.
a little bit of that. And the other thing is, if you look, one of the things you see on the before picture is that your face was, younger than it would have been. It's also bigger than it would have been. And so we made it smaller and more elegant and more tapered and feminine. And it's really held up nicely, and your face moves better than it did. I always talk sort of philosophically about the face. The purpose of the human face is to express communication, emotion. And so anything that gets in the way between the muscles of the face and the skin interferes with that, and it makes you look inauthentic. And we're not treating a photograph, and we're not even treating a video. We're treating a live person that you see these things in person. So that's kind of what you had going there, and we got you off that road.
Yes. Okay, so we've had some questions come in, but I want to get to like some of the risks, because how do you find, first of all, there are some risks. People do die on the table, right? Joan Rivers died on the table.
Yeah,
And
she
so
was
there
having
are, yeah, which is
yeah.
so tragic, because
Yeah, it
I
wasn't
use that
plastic
quote.
surgery. It was a laryngoscopy, and that leads into something. Well, yeah, the risks, that is one risk. Before I forget, Joan Rivers was having an endoscopy, an upper endoscopy, and I think they biopsied a vocal cord nodule that they didn't know what it was, and they failed to protect her airway at that surgery center, which is obviously since shut down. But that's one of the risks, and that's why I use deep sedation. I use a total intravenous anesthesia, so it's not general anesthetic, but I intubate, or my anesthesiologist intubates. He does
That
it very
means, you guys,
gently.
you have the tube down the airway.
Yeah,
That's what that means.
it's Yeah, if that Joan Rivers had that, which I guess you can't in an upper endoscopy, but if in a plastic surgery procedure, I think it's important to do that. And a lot of surgeons don't do that. They'll argue that it's better or safer not to be intubated. But if you have the best of both worlds, which is the IV propofol and intubation, your anesthesiologist has to pay very close attention the whole time. And I have the best in Beverly Hills I've been working with for years exclusively. It's more expensive, but it's obviously it's your life. The risks are very small, but yeah, you got to be aware that there are serious medical risks, and it's not a trip to the nail salon.
No, it's not a trip to the nail salon. No, it's not. So if you look at the statistics, it's like if you go to a board certified plastic surgeon who specializes in whatever you're doing, you don't want to go to a dermatologist to get a facelift, you guys. That's not what their training is. But you could go overseas and these people are doing this all the time, and that's where people are dying. But if you're going to if cosmetic surgery that is generally safe when performed by a board certified plastic surgeon, who is accredited, the mortality rate is 2 in every 200,000. So
Yeah,
it's
it's very low. I
it's
mean,
very
yeah, I think
low.
a lot of times it's someone that has an undetected medical problem. Some of the time it's they're unforeseen heart conduction defects or things like that. A facelift surgery is very safe. It's not one where there's going to be uncontrollable bleeding or anything like that, and it's not one that involves a lot of fluid shifts. With liposuction and body surgery, sometimes there are a lot of fluid shifts. Those things can put stress on an otherwise on a fragile heart or marginal. So you've got to be really careful, and that's why I get a thorough medical clearance with board certified internist or subspecialist before I do any surgery. I don't care if it's a breast augmentation on a younger patient. We always do that as a precaution.
Yeah, it's interesting because when you then look at the statistics for non-board certified plastic surgeons, the deaths are 1 in 11,000. So
Yeah, I mean, I think that's, I always say that if I can't compete with a dentist who's doing, breast augmentation, which sadly, strangely does happen, I shouldn't be doing it myself. And so, but those things should be regulated better, probably. If you have a medical license, you technically are allowed to do any procedure that's done. So it's more controlled by residency, qualifications, the American, the accreditation committee. And it's just something that you want to go to a board certified plastic surgeon,
yeah,
definitely.
yeah, absolutely. We had a question from Cher Bear. Hi, Sherry. How long does a facelift surgery normally take? How long are you under?
Yeah, I think that's something that, for me, it takes a long time. I take probably at least 5 hours up to 8 or sometimes more. We use very light anesthesia, but, I always tell patients as long as it's done safely, which it is, it's not how long it takes, it's how long it lasts. And this is very fine work dealing with the deeper layers. And so it should be done gently and carefully. I think saying that I want to split up, I want to only be under for 4 hours, but I want to have multiple things done and just wait and do the other ones later. That's kind of like saying I want to fly to New York, but I want to stop in Chicago on the way because it's safer. It's actually safer to do it all at once, as long as the right precautions are taken and the right things preventing DVTs, which is a blood clot in the leg. There's certain things that risks that can happen that you have to be fastidious about doing all the maneuvers you can to avoid those things.
Yeah, exactly. Somebody says Sarah said her facelift took 17 hours.
Yeah, that's a long time. That's definitely a long time. That's too long in my opinion. But there are surgeons that that take that long. As long as the anesthesia is lightened at the end. There's reconstructed. I was just talking to someone that trained with a face transplant surgeon in New York, and those take 36 hours. But that's a different procedure. It's a reconstructive procedure, so it's not to be judged maybe as much as facelifts do. But you should try to be efficient. But to be honest, I think in certain areas, certain cities, there's a predisposition to bragging about how fast you can do a facelift. If and when I have one done, I want it done slowly. I want it
Exactly.
done methodically and gently and
I know.
slowly.
I think I called you that, or we talked that morning. I'm like, did you sleep well?
Yeah, I
Are
don't.
you like,
Yeah, I sort of, being a surgeon, especially a facelift surgeon, is kind of like being an athlete where you have to keep your body in shape. And I work out rigorously, and I have a resting heart rate of 44, which is partly just because I have a, chronic, uh, you know, mellow personality maybe in some ways. but I also think it's important to be at your best and have stamina to do this type of work.
Yeah, exactly. So this is not the time, you guys, to go bargain shopping. And I get this question all the time in terms of the cost, and it varies greatly depending on the skill set, depending on, you know, the education, the number of years in practice, that experience,
Hmm.
and also your zip code, because
Yeah,
that
yeah, I
plays a
think.
role.
Yeah, I mean, you want to say that, I guess you could say you pay extra for the 90210 surgeon, but at the same time, if that surgeon is well known and busy, then there's a reason for that because it's a very competitive area where we've got patients flying in from all over the world. You know, I am one that for a long time I've been charging, you know, more than most, and it's something that I've in freshman economics at Harvard, I learned that if there's a line outside your door, your prices are too low. And you know, this is not something that we're trying to do on everybody. It's not charity work. I do a lot of charity work. It's something that I charge what I think and my patients feel in the end is worthwhile. But there are, you know, you can get excellent work for less, but I think facelift surgery is evolving to be so complex that you're paying for a real upper echelon, a rarefied air of surgeons that's able to do this niche work and do it artistically and effectively and gently. And so it's worth paying for. I mean, I tell patients that, you know, you can buy a Bentley. If you can buy a Bentley, you drive it around for a few years and then entropy makes the car kind of, you know, go to hell. But you don't wear it on the front of your head like you do your face. So it's worth paying for. I mean, I'm walk the walk. I'm going to pay a lot of money for my next round of a few hair grafts. And I'm lucky to be able to do it, but it's well worth it to me. And now I'm on the other side. I'm like, holy shit, it's going to cost me that much. I don't ask for discounts. I want them to put 100% into it. And I found also that, you know, and I tell this to other surgeons, if a patient asks for a discount and gets a discount, then there's a natural tendency to assume that the surgeon discounted the effort they put into the procedure as well.
Mm.
So that's something that, you know, there are great surgeons out there in different zip codes that do beautiful work. I personally feel that because, you know, we and I in particular take care of a lot of entertainers, they come to me and people, the word kind of filters through sometimes. We certainly don't talk about it, but they just know the general idea, and there's definitely something to that.
I definitely want to get into, somebody said, which is your hair transplant
Yeah,
doctor? I'd love to have you
yeah,
back on afterwards, and we'll
yeah,
do a before and after, because we do get a lot of questions about hair
yeah.
loss and, you know, new technology that's coming out. I'd love to see. I
Well,
know that you're going to the best of the best.
I'll answer that question. Gary Parole in Beverly Hills is I think by far the best in Beverly Hills. He's expensive, but has done beautiful work on me. And then I went to Ron Shapiro in Minneapolis, who I think is the best in the United States. Very natural, beautiful work. He lectures a lot like I do. And then I'm going to Munib Ahmad in near Amsterdam coming up. So you can look at his. It's called FUE Genix, FUEGENIX, and just, you know, he's OCD. He's kind of like obsessed with doing it as naturally as possible, and having an artistic eye, I can tell when people have had it done, and so I want just a little filled in and the best that I can. So I'm
Well, I
honest
can't
about
wait.
it.
I can't wait for that. So when you're looking for a plastic surgeon, besides being, you know, American board certified and all of that stuff, I think multiple appointments with various doctors is so important. You were my fourth doctor
Hmm.
that I went to.
Hmm.
So I
Yeah, there.
saw
Yeah.
three other doctors first before I made that decision. I think that that's super
Yeah.
important.
Yeah, it's important. It's not just deciding on who technically is best for you. It's do you mesh with who they are? Do you feel like this is someone that you trust that's going to be with you throughout the journey? That's certainly something that I've embraced. But everybody's style is different. You know, I have a boutique practice. I'm not trying to do, you know, 5 facelifts a week. I do at the most three, and I put a lot of love and care into every one of them. And then, like I said, I get to know a lot of my patients, and there's a, you know, I have a great practice. I have a lot of very formidable, successful business women that have become really good friends of mine, you know, after I make sure they're happy. And then it's become a great kind of a family.
Amazing. Okay, I want to get into, because we've got about 8 minutes left. When we talk about pre-care, and I talk about this with a lot of my one-on-one clients. For those of you who want to book a session, listen, a lot of times what I do is I'll work with people one-on-one on getting them optimally healthy. And then when they still want that little bit of, I feel like I still want to go under the knife, that's when we start looking at plastic surgeons. But to get to that point of like, I want to have surgery, and I want to just say this one point. You know, for those people that criticize plastic surgery, or, oh, you should just age gracefully, or age, you know, just let the chips fall where they may. I had a mission, which is 50 years old and about 70-year-old. So that's where I'm planning on having my two. I'm not going to only have one. I had my first one at 49 because I got married and got this result in my neck. So that was like perfect for me. I plan on having another one probably around when I'm 70, and then just letting the chips fall where they may. And that has to do with healing rates and all of that stuff. So when you're planning a surgery or you're planning to go there, I always tell patients you want to be in your best fighting shape. You want to have your weight down where you're in a healthy weight management, because when you're doing a facelift or you're doing other things, you don't want your weight to fluctuate. You want to make sure that you're healthy, you're doing all of that stuff. But what are some of the stuff going in? What are some of the precautions going in that need to be addressed prior to going under the knife in terms of like supplements and all of that kind of stuff?
Yeah, your health has to be optimized, and I think people that are on the right supplements that work with their body do better. People that are physically fit do better. People that are athletic, within reason. A lot of people are busy working, so they can't work out twice a day. Those things are better to optimize. And speaking of supplements, we do have people quit their supplements in general a month before, because some of them can thin the blood. We don't want to take, it's mostly an issue of them having more bruising afterwards. But those are important. But we've, in the immediate pre-op period, we've also started doing hyperbaric oxygen, where, it delivers high percentage oxygen, 100% oxygen under high pressure. And there are studies that show, there's no question that, and I've been doing it for 25 years because we did it in my training with reconstructive surgery. It works for necrotizing fasciitis, which is the, flesh-eating bacteria. It's one of the mainstays of treatment of that. If it works for that, then it's going to work for your skin, for your blood supply of your skin. We do that before and after, and I can tell people that have had the hyperbaric afterwards because the incisions just fuse together over the first 2 weeks. Not everybody can do it. There's a little slight risk to it, some ear pain and things like that, but that's definitely a must as well, just priming and optimizing. And again, making sure you have a thorough medical clearance, making sure your labs are okay, your blood count, clotting factors. We do a really thorough evaluation of that. And maintaining a stable weight. So Ozempic is one of the things that people ask about a lot.
Yeah.
Ozempic, I don't like operating people that have had to rely on Ozempic to lose weight. There are people that are on it for other reasons, to maintain their blood sugar, lower doses, and I do occasionally do it, but that the protoplasm is kind of impaired by the extreme use of Ozempic.
That's so interesting. I just didn't even think about that as being an issue. But that makes perfect sense. Yeah,
Yeah, yeah, and the thing is, how are they going to maintain their weight afterwards? You see people that have had a bunch of liposuction and haven't really stayed in good shape, and their head gets big because there's a lot of fat that kind of goes in, native fat that blows up in their face, and they start looking like a frog. And that's not my type. I just tell people, just get in shape and do it the right way.
yeah, exactly. Well, here's another thing. If you just think about it logically, if you're having liposuction done and you're removing fat cells that used to be supported by your diet, and you get rid of those fat cells, but you're still eating the same, you're going
Yeah,
to multiply those fat cells and fill up those ones that were flattened. So
yeah,
you have to do the lifestyle change first
yeah,
to get the best
yeah.
results.
And that's what I love about what you recommend, and that's why I felt strongly about coming on here, is because if all my patients could follow you, they'd be primed for surgery. They know what to do that's healthy. It's beauty and youth from the inside out. One of the people that's on here watching commented that it's not just about living longer, it's about staying younger longer, and not about lifespan as much as it is about health span.
Yeah.
Because part of the human condition is that we're mortal. And so one of our goals is to make as many human connections as you can, and to be part part of the collective of humanity. That's the most important thing about humanity.
One.
That's the way to live longer and to have a happier life. But all these other things make you more able to reach your potential and have your full kind of inner beauty come out more.
100%. If you're somebody who's been on the fence, but like, you know that there is something that bothers you, like, oh, like for me, when I'm in a downward facing dog, listen, I work out like a beast. And I could be like in a downward facing dog during yoga, and I grew 3 human beings in my stomach. And there's little things, if I'm in a downward facing dog and I see that crepey belly skin, it automatically, my head goes from this peaceful place to, I don't like that part, right?
Yeah.
So self-esteem plays a big role in that. And if you think that self-esteem, to feel good about yourself as you're walking through the aging process, has a profound effect on our health.
Yeah.
Because it
And
changes
I think,
what you do.
I think so. And I know that you look at yourself very critically because you're beautiful and fit, and that there's little things bothering you, and then you move on. You don't want to get too obsessed with little details, and that's kind of an unhappy person that's too obsessed with that. But it's not just about feeling better about yourself when you look in the mirror. If you have the right plastic surgery done and you look younger, but it's not noticeable that you had it done, other people look at you more and they listen to you more. And so it's about objectively looking better. That's really the goal. That's the way I kind of see it as an artist. You have to maintain, a healthy psychology at the same time.
Exactly. So psychology is so important. And, our skin is our largest organ. So nobody can say like, oh my gosh, look at your bones, they're not doing great, or look at your, nobody can see that, but we're face forward. And our self-esteem is held very much in our face. And so if it is something that you've been on the fence about and you feel like it is interfering with how you're living your life, how you're holding your chin up, what is causing you to be self-conscious about something, you might not be as, comfortable speaking up in a crowd. You may not be comfortable going back to school. You may not be as comfortable having getting married again. Whatever it is, that plays a role in your health. And so it's at that point that you really need to, for you, weigh the pros and cons, see a bunch of different surgeons, come up with a game plan, and then you make that own personal choice. That's all I got.
Well put. Thank you.
All right, Dr. Mani, thank you so much. How can everybody find you? Let's end it with there. How can they find you?
Yeah, I'm on Instagram at Dr. Marc Mani, Dr. DrMarcMani, and I think there's probably a link here. And so call my office or email. There's an email associated with my Instagram account. People can message me directly on Instagram. And if they want to have a consult, that's how I would answer questions about them. We typically want to see pictures emailed to my office so I know what the patient has. And if someone has a lot of filler or they look weird and they're okay with how they look, I generally will not want them to come in because I want to change that. I want to make them look more natural. If they have fillers and it stretch out their skin, then I'm happy to help.
Well, I'm going to invite you on as a collaborator so that you'll see the same question. When I post this to my main feed, you guys, which is going to happen right now, I'm going to invite Dr. Mani on as a collaborator. If you accept that, you'll see the questions coming in as well. All right.
Okay, perfect.
Thanks, everybody. I'll see you next Saturday. We'll be talking about hormone health. This encompasses a lot of different things. Thank you, Dr. Mani.
Thank you, Darnell.
Have a good day.
Thanks, everybody.
Bye.